of topics. I'm joined by Jane Marwick, host of Marwick on Sunday on 6PR, and on the front page here it's Sky, plus former Senator and former Leader of the Australian Conservatives, Cory Bernardi. Thank you so much to you both. Can I just start? We'll have to go to the coronavirus, of course. Just 100 deaths yesterday, which has obviously surprised everyone, the government, anyone who believed the government or other forecasts around there. Cory, the Morrison government today released a couple of pages of the modelling it claims have been working on in predicting all these horror scenarios. I'm not sure we got the whole lot to explain what seems to me a drastic overreaction and a drastic overestimation into how badly the coronavirus would kill us and overwhelm our hospitals.
Andrew, my suspicions were very similar to yours, and so I actually looked up the modelling on the website of the government, and I found a number of anomalies there, and it's wise, I think, for the Prime Minister to distance himself from them because the modelling hasn't been peer reviewed. It's based on some data that came out of China, which could be dodgy, as we would expect, but it also takes what is a very discrete set of numbers and extrapolates them out as if they're going to continue in perpetuity. And whilst it acknowledges there's a lot of unknowns in it, since the modeling's been produced, they haven't really identified those without symptoms or asymptomatic that suggests that there could be millions upon millions of people, which has been acknowledged now in Europe, who are walking around with no symptoms, who aren't included in the data, which makes the death rate, which makes the hospitalisation rate, which makes the risk that much less than what is being published. But what the modelling does show today is that the highest risk is for those over 50, but particularly acute for those over 65. And quite frankly, it supports the case that those in those higher risk categories should have been quarantined, should have been isolated, should have been cared for, and the rest of us should have been able to go about our business without fear, without being worried, and without crippling our economy.
Well, look, Cory, I agree that is the route now, and I've said that a week ago, although I thought, there was so much we didn't know about this virus. I thought caution first, yeah, lockdowns and all that, but now it's wildly... Jane, here's what I don't get. We are locking up all Australians, as Cory just said, not just quarantining the infected and the vulnerable. Last year, though, we had dozens of elderly people, particularly in nursing homes, and from Sydney to Perth, including Adelaide and Melbourne, dying of the flu. But in that case, we simply shut up the nursing homes and not everyone else. Is that going to be, should that be our future exit strategy here?
Look, I don't want to be too critical of the government, Andrew, because I think there are so many unknowns about this virus. China has not been open and accountable. If we go and look now at the number of urns in Wuhan, the estimates are that about 42,000 people may indeed have died from COVID-19. I think the government took a cautious approach, and we only need to look at Boris Johnson to see how sick he is. We don't, and you listen to the doctors who are looking at the scans of the lungs of people and saying that they look like they've been grated. So I think the government took the right approach. We've taken a tremendous economic hit, and we get it on Talkback Radio every night, people who are really itching to get out. I'd like to see wider testing and indeed the antibody tests, so those of us who can get out and get cracking and get working can. But while the economic pain has been enormous, I'm going to congratulate the Morrison government on being cautious, because they couldn't win this one. Had they said, right, we'll just keep elderly people at home and everyone go about their daily business, and a whole lot of people had died. And let's not forget, it's not a nice death, it's an agonising death by all accounts.
No, I got that.
I think... Yeah, so...
No, I agree with you, Jane. Look, I've always said we didn't know what we were facing. It was very unclear. We had the example of Italy, which freaked everybody. So, yes, caution first. But, Cory, the thing is, now that the real results in Australia are obvious, you've got to be nimble. This idea of 6 months of these devastating lockdowns, I mean, they're devastating in terms of how they affect people and business and money and people's jobs and everything. You've got to adjust to the reality.
Well, of course you have to adjust to the reality, and we did have some precursors to this. I mean, SARS and MERS are just other versions of a coronavirus, and this one's particularly debilitating, and it's got through many other countries rather than they did. But there was a great article today in The Australian, Andrew, by Alan Jones, in which, there are a number of people who say, well, the predictions have been wrong. They're alarmist. Like any modelling, it's about the data you put into it. And you've got to admit that the modelling might have over-egged the pudding a bit. Now, we've seen this in the climate change debate. They refuse to acknowledge the falsehoods and the peddling that's gone on there. I suspect there's a fair bit of backside covering going on in this space as well. And that's why the Prime Minister took a step back today and said this is one input for Cabinet and we're going to consider a whole range of other things. And that does show he's nimble. It shows that he's started to listen to others rather than just to the medical experts.
I think that's correct.
Of course, want to take
I think I picked that up too, Corey. I think I picked that up too. Jane, he mentioned the word weeks for the first time, not 6 months. I think that's significant, don't you?
Absolutely, I think it's significant, and there are a lot of people who really do need to get back to work. The economic harm is enormous. We've done a terrific job. I understand our medical professionals are concerned. They're in the front line. But yes, I noticed a change in tone from the PM today. So wouldn't it be terrific if we could start to at least get out, particularly where it's really onerous for you in Victoria, Andrew, where children who are doing a little driving lesson with their parents get pulled over. I know that fine's been revoked, but I mean, talk about the police state. That's been over the top.
Well, I live in it. Thank you very much. Thank you very much, Jane Marwick and Corey Bernardi. I'm so sorry it's a short, truncated thing, but we had trouble establishing connections before. But thank you so much for joining me. Hope to have you back very soon. I should correct myself. I said 100 deaths yesterday. Of course, I didn't mean 100 deaths. I meant 100 new infections yesterday. The death toll, I think, is, 47? I haven't checked. The Pell thing has confused me, has distracted me. 100 infections yesterday, but many more recoveries. The number of people sick right now is actually falling like a stone, which is actually great. So why are so many emergency beds being left empty, and why have we had voluntary surgery, what do they call it? Elective surgery cancelled to make room? We don't need to do that anymore, surely.